Thanks everyone from Cornell Wheel, as well as Rockefeller University. Also, big thanks for coming out on a sunny but cold morning. As I was walking my dog, I was thinking about what I was going to say, and it was 6:30 in the morning in Fort Greene Park, and I looked, and it was 5 degrees. So I said, time to get home and get to this conference. So anyways, as Andrew alluded to, Innocent was unable to make it. He's actually, he's so passionate about healthcare and entrepreneurship, as am I, that he was stuck. I didn't know this, but he was teaching a class at entrepreneurship at INSEAD in the UAE, in addition to running the business and hiring 30 more people with me and doing a lot of other things. So we're both very focused on growth, mentorship, and entrepreneurship. So let's talk about chronic disease. 60% of adults now in the United States live with at least one chronic disease. 40% live with 2 chronic diseases. Traditional care is definitely reactive, it's not proactive. Here are some baseball statistics. Only 8% of Americans have seen the same primary care physician in the last 3 years. The average person spends 13 to 15 minutes a year with their primary care physician. So when you think about whole body care, right? Primary care, nutrition, behavioral intervention, lifestyle, there's no way you can accomplish that in 15 minutes. What we've done is basically created, we call it high tech and high touch, but an AI-driven clinical decision support system care model to transform chronic disease management, and most importantly, not just manage symptoms, but get to the root cause of the illness. What's causing that inflammation? What's causing that disease? Not only treating it, but reversing it. Okay, so again, no. It's not working. Hold on. Test. Oh, there we go. Okay. Again, let's talk about the current challenges, right? Fragmented care and poor patient engagement. People are being volleyballed around, and what's really driven costs in healthcare is that they're going to specialists, they're going to ERs, but there's not a care continuum, right? That leads to poor patient engagement, that leads to disengagement and really disillusionment. We talk about the high costs, we talk about limited personalization. A lot of programs are cookie cutter. We're believers that everyone has obviously a unique biochemistry, and within that biochemistry, we have certain biomarkers, right? In order to understand what the root cause of disease is, we need to understand people's individual biochemistry and biomarkers. When people come on the Ciba platform, we look at their claims data, we put them through a very detailed questionnaire, but we also run them through 90 lab tests, 300 biomarkers, approximately 10 to 15% greater than what you would normally get going to a doctor. And we really understand what is going on, and we put them through a personalized care treatment plan. We'll talk about that shortly. Also, the number one, obviously, way to treat any illness, whether it be something you can reverse or something more intensive like a cancer, is obviously early detection. Digital first powered AI care. So as I was speaking about earlier, these AI powered predictive analytics, we are tracking with connected devices. We're tracking heart rate variability, resting heart rate, blood pressure, sleep quality. When people come onto the Ciba platform, they get a kit with a blood pressure cuff, a Withing smart scale, a CGM, an Oura ring. We want to understand everything that's going on so that when we see any deviations in any of the measurements we're taking, patients get a notification as well as the care team, right? These, as I alluded to, these personalized care plans are tailored to the biomarkers. Furthermore, we call it, again, high tech, high touch. The high tech is the remote patient monitoring with the technical devices they get, the technology. The care team is full, complete whole person care. So that includes a double board certified physician, a behavioral therapist, a health coach, a dietitian, and a nurse care manager. Here's another look at basically what I call the 4 pillars of Ciba. It's that root cause medicine, right? Understanding people's biochemistry and biomarkers. Getting to what is actually causing the problem, not what the symptoms are. Up here in the tree, right, we have all of these symptoms, right? People come in to a doctor and they say, okay, I have irritable bowel. Okay, we're going to give you Xifaxan, right? Or I have an RA condition, or I have depression and anxiety. What they miss in those 13 or 15 minutes is the comorbidities or the polychronic conditions that are affecting people, right? So they don't take the time to understand the patient, and they don't take the time to understand what is actually afflicting them at the core, what's causing inflammation at a cellular level in their body. So basically what happens is that we have it's called our digital front door. We have a risk stratification model. So what we do is we look at the claims, their claims data, we put them through this very intensive questionnaire, and then we run them through the biomarkers. And based upon that, we have a proprietary engine that clusters the data and assigns them into one of 2 programs. Cardiometabolic, obviously for hypertension, hyperlipidemia, obesity, prediabetes, type 2 diabetes. But there's another group that are the silent sufferers. The silent sufferers are those that have digestive issues, autoimmune issues, depression and anxiety. And the silent sufferers make up a large portion of our population because it affects their life dramatically. And you may not see it in, for example, like someone that's obese or type 2, but there's a large majority of the population that is suffering from these illnesses and also driving costs, and we'll get to that shortly. I talked about the coaching. Again, it's we put our patients through a 12 to 24 month journey. It's basically monthly check-ins with the doctor, the dietitian, the health coach, and furthermore, you can. It's two-way communication, so you can chat through an app on your phone, on your laptop, on your iPad to engage with a care team. A care team member usually gets back within 12, no later than 24 hours. Here's a client case study, and this is fascinating because it's only 100 patients, but you'll see, we'll get to the cost savings. So this is a client that came on our platform, and they obviously knew what was driving their costs from a healthcare perspective. 100 members, 50 that came into the program had cardiometabolic issues. Another quarter basically had GI issues, and then autoimmune conditions, right? You see the initial medications they were on. After going through the program, the monthly, that's the reduction of medications at year end. So people went from a total of 150 medications in our cardiometabolic program down to 23. Most of our, we have 4.5 years of data, and most of our patients that go through the program reduce medications by 85 to 90% or completely eliminate medications. The gastrointestinal issues, right, the proton pump inhibitors, and then the autoimmune conditions, the biologics, which are significant drivers of cost in our healthcare system right now. But what you can see is that there was a reduction basically from $89,000 a month for this patient cohort down to just under $14,000 after 12 months. The savings are obviously considerable. Again, these are our results, right? 85% reduction in GLP-1 dependency. We have a GLP-1 step therapy program. So it's either the way it works is that if you want access to a GLP-1, we work with a company's PBM, and before they get authorization, that'll automatically redirect them to a Ciba Care practitioner, one of our board certified doctors. And what we're trying to do there is we're trying to understand, do these people need GLP-1s? GLP-1s overall, to take something once a week or once a month for your entire life is totally unsustainable from a lifestyle perspective and a cost perspective. We are believers, though, however, that it is a good boost to get you onto a program to see immediate results, right? What we like to do is titrate down or totally eliminate those medications, right? And with the reinforcement, you go into metabolic rebalance basically in 4 to 6 months, right? And you start to see this positive reinforcement cycle where these people realize that with advanced primary care, with nutrition, understanding of nutrition, right? That you can eat foods high in fiber that naturally produce GLP-1s in your gut that these people don't need to rely on medication. Some other things that we've achieved is 2 points A1C reduction. These results, by the way, were where we completed an independent study of 14,200 patients that went through the Ciba program over 3 years. This independent study was performed by the Validation Institute, and obviously you see what they found is that 85% medication reduction, what we call 90% symptom improvement or elimination after 12 months, 2 points A1C reduction, 75% program completion. What that means is that, let's say there's a company that has 5,000 employees that we identify as eligible members. What we found is that we've been able to engage and onboard 50% of those, and 75% of those members completed the program. Why is that important? Because the only way you can have the best technology and clinical decision support system, but we're firm believers that in healthcare, you not only need technology, you need human touch, right? People need to interact. They need positive reinforcement. Also, from employer standpoint, from a payer standpoint, that leads to the return on the investment, the value on investment. One thing that a lot of people don't think about, and companies are realizing this, is the cost of inaction. And when I talk about the cost of inaction, and I talk to these large health plans and these large employers, they realize that their healthcare costs are up 100% over the last 10 years. And currently, they're on track to double in the next 5 or 6 years. So by getting those engagement and program completion rates, we deliver those ROIs and VOIs. Where we are, as I said, innocent, we have offices in the UAE. We have offices in Canada. We will be expanding to Europe in the next 12 to 18 months. We're actually talking to 3 large pharmaceutical companies that are interested in partnering with us and leveraging our technology and our data to understand how to better transform and improve chronic care management. And then we have a JV in China. Next steps, right? Again, we talked about healthcare moving from reactive to proactive models, taking the time up front to understand not only their biochemistry, but society, their family situation, their family history, their relationships. Environmental toxins are a big thing, right? So what's going on? But really, what's key here is leveraging generative AI and our clinical decision support system and basically health agents to interact with these patients, ultimately deliver them to a care provider and get them on these care plans and provide advanced primary care, behavioral therapy, nutrition, better nutrition and lifestyle management. That's it. Thank you very much.
Future of Care is New York City's premier community for healthcare innovation. To learn more, subscribe to our channel and visit our website at futureofcare.nyc.